Hare Krishna, everyone.
Hare Krishna.
Hare Krishna. Very happy to see
Haribol.
your faces again. Hare Krishna. Hare Krishna, Greg. And Vatsala.
Hare Krishna.
Hare Krishna.
Probably.
Please accept my humble obeisances. So glories to Srila Prabhupada. We're very happy to see you all again at our third reading session. I believe Sangeeta Mataji is not in yet, but she will join shortly. Welcome again. I think we have mostly the same devotees who have been part of the reading. But for those who joined recently, this is a reading club for Final Journey. It was written by Sangeeta Mataji. She's Srila Prabhupada disciple. She's been a hospice nurse for 30 years. She's also certified counselor, grief counselor, and grief educator. She's facilitating a grief support group on Facebook for devotees, for Vaishnavas. And somebody's trying to say something, or no? Okay. I think maybe, yeah. Yeah, we're just delighted to continue reading of the Final Journey and to learn more about the process of how to take care of devotees at the end of life. And hopefully get inspired more about the service and take the seminar and then form a team in your respective country or place. That's our hope and prayer, because we want teams, Vaishnava care teams in every ISKCON community or center out there, because it's very much needed service to take care of those who are sick and who are at the end of life. So we welcome everyone again, and we will pick up the reading where we've left off. Actually, no, I think we thought we can just kind of go back a little bit and start from that section where we read a little bit already, but we're just gonna kind of start it over again for those who missed it. Yeah.
Taravali,
Yeah.
it would be so nice if devotees can share with us in the chat box where are you connecting from. This is very important. From which city and country will be so nice. And also if you can put on the chat box from the beginning. And also will be so nice if in one word or a short sentence you can let us know what you think from these chapters in this session that we are having until today. What do you think just about the book, about the reading, right? That
Yes.
would be so nice, a feedback.
Wonderful idea. Let's do that. Sorry if you hear some kids in the background. It's my kids. Sorry, I apologize for that. So I'll mute myself. So yes, please, let's share in the chat and where you're from. And you said what inspires you about the Final Journey reading?
Yeah, one word, a short sentence, that would be so nice. Maybe we can give some minutes. I know we don't want to take more time of that we ask on every reading session, but it's nice to know what do you think about it. So maybe Taravali, you can read some comments and then we can go on with the schedule.
Yes.
Thank
I'm just trying to open the chat. It says Hare Krishna, Ishwari, and Hemavati from Ottawa and Montreal. Haribol, we're neighbors. We're from Toronto. Brighton, UK, Greg, yes, we've met last time. Hare Krishna. Karuna Purna Shakti, Mataji, we also met from North Carolina. We have devotees from South Africa, inspiring and educational, Shama Manjari Mataji. Sorry, I'm just trying to scroll down. Heidi Moss from Boston, beautiful look and class to be of service to sick and dying devotees, wanting to assist further in such care. Jai. Yuvata Sundari Mataji, yes, from Israel, my friend from a long time ago. And Lalita Lalita Mataji, Alachua, Florida. I'm also hospice RN. Jai, yes. we need to create like a separate WhatsApp group for the hospice nurses, of devotee hospice nurses. Hare Krishna from Warren, Arvind Koshik, Jai, Jayananda Das from South Africa. And Heidi Moss is a counselor. What kind of counselor? Please share with us. Rajeshwari Pran Devidas is from St. Louis, USA. Being a nurse practitioner, I'm interested in hospice and end-of-life care for devotees. Another nurse. Wow, this is amazing. Vatsala Mataji, Hare Krishna, Vatsala Chok from Philadelphia. Great book, valuable association of all the devotees. Great no travel and Mother Sangeeta Haribo.
Haribo.
Hare Krishna, Induleka, Hare Krishna Sangeeta Mataji. We're just reading devotees, where they're from and what inspires them about the final journey. Induleka from Boston, Induleka Mataji from Boston. This book is so educational. Was lost. I was so lost when my mom was leaving body. I wish I had this book then. Yes. And Heidi Moss, I work a lot with those on the autism spectrum and with grief loss. Wow, this is amazing. Maybe we can connect more with these devotees who are in these areas and see if you'd like to, help more or with Vaishnava's care. That would be wonderful. And then Aradhana Devidasi, Hare Krishna, dear devotees, I'm from Toronto, Canada. Thus far, I feel this book is a precious contribution for the most important life journey we're all going to take. A great training, I believe, we all need. That's so nicely said. And then Surrender Krishnan, currently in Massachusetts State, USA, leaving for India on the 18th, next week onwards, India attending to gain knowledge. Jai. And Greg mentioned hoping to see what we learned for the benefit of our and wide Vaishnava communities. Yes.
Very
Yeah,
nice.
and Yamo said, yes, let's connect offline. And then Yuvati Sundar said, yes, really great book. I'm working in spiritual care. Yes, that's so wonderful. Jai, this is just mind-blowing. Devotees from all the world connecting in this service to Srila Prabhupada. Something we all have in common. To take care of devotees at the time of need. Haribo. Sangeeta Mataji has joined our reading, and we will continue. And Rasika or Kandarpika, please take over where we started, where we finished.
Please,
Sorry.
can you make, Ravali, can you make Rasika co-host so then she can share
Yeah.
the final journey?
Yes. Let me.
Press
Sorry.
on.
Yes. Okay.
Oh,
It's done.
good.
We're gonna. I think we went. Should we travel to the Holy Dam? That's where we stopped, but we kind of went half section here, but we'll start from the beginning just to kind of remind ourselves and read with for those who missed the last session. So, okay.
Hare Krishna, everyone. Thank you so much for being here. Let's continue with our reading. And let me share my screen. Oh, I can do it. It's telling me it's disabled for me.
Oh,
Just one moment, Ravali can make you co-host. Now you can.
what is Heidi Moss saying? She's on a train. Taravali, do you have that? Her
Yeah, she's
message?
on the train to go to Harinam, so she'll listen in. Jai.
Jai.
Multitasking.
In the best way.
Right? Yeah, I think we read that part.
Yeah, I believe we're on
Yes.
page 9.
Yes. Well, we were in page 19 and we stopped at further in smaller villages.
Okay.
Page 19.
I don't think we went this far.
Yeah. No, we didn't.
So maybe just start from, do devotees need to maybe go more up.
Yeah.
And
Yeah.
I thought
So
good.
we stop here in this section. Further in smaller villages, it may be difficult.
do you think we can start from the beginning of that section just to kind of refresh memory?
Yeah.
Yeah.
And could you make it larger, please,
Yes.
for the old and almost blind people like me?
Yes.
Thank you.
Okay, should we
We can
start?
start here, yeah.
Okay. Would anyone like to start? If you can raise your hand, that would be good.
We have C.A.R.E. Thank you.
Hare Krishna Mataji. I can start. Should we travel to the Holy Dhamma? In Bhagavad Gita 8:21, Srila Prabhupada writes in his purport, Krishna's supreme abode and Krishna himself are non-different, being of the same quality. On this earth, Vrindavan, 90 miles southeast of Delhi, is a replica of that supreme Goloka Vrindavan located in the spiritual sky. When Krishna descended on this earth, he sported on this particular tract of land known as Vrindavan in the district of Mathura, India. Being able to leave one's body in the place where Lord Krishna performed his transcendental pastimes is the most auspicious event. Such a fortunate soul as this would surely receive the Lord's blessings. But such a situation must be well planned, since living in the holy Dhamma means added austerities. Even the lengthy plane ride is rigorous and must be realistically decided upon according to the medical needs and physical strength of the dying devotee. Being accompanied by the caregiver who can administer medications, provide prasadam, and manipulate any special equipment such as portable oxygen tank if needed is essential. Since the first edition of this book was published, His Holiness Giriraj Swami has overseen the construction of a well-equipped and beautiful hospice facility in the Holy Dhamma Vrindavan, India called Bhaktivedanta Hospice. This inpatient hospice has its own temple room with the Jagannath deities and is also just a few-minute walk from the Krishna Balaram Mandir. However, if your patient prefers to stay elsewhere in India, you need to consider the following factors. To begin, one would need to arrange for adequate housing. Ideally, it should be clean and comfortable, have a generator for electrical backup due to frequent power outages, have proper lighting and circulation, air conditioning and or fans for the hot summer months, some type of heating system for the winter months, have cooking facilities with a refrigerator and a private Western style bathroom. It would be best if the room were on the ground floor and was wheelchair accessible. It should be noted that many drugs routinely used in hospice and palliative care in the West are either difficult to get or unavailable in India. In addition, some of India's pharmaceutical companies produce medicine in compound formulas, so the devotee may be taking unnecessary medications along with the ones they are needed. Medicines in India often come in injectable or tablet form only. As of this writing, alternate routes to oral medications such as rectal or sublingual medication that dissolve under the tongue are fairly new concepts in some places in India. Medications given intramuscular IM injection are rarely used in hospice care. For a hospice patient who is eating poorly and who may be even emaciated, IM injection can be uncomfortable and unnecessary. Suppository medications under concentrated liquid pain medicines given under the tongue are often required if a hospice patient is eventually unable to swallow tablets. Further,
can I say something for a minute? This was written originally in 1999. The second edition was written maybe 10 years later. So things may have changed, but the last time I was in India a few years ago, it wasn't changed. Sometimes out in the villages, like in Vrindavan, it's difficult to get medications there that are not compounded with other unnecessary medications that the patient will not need. So I think we're still running into those problems there. The last I was there anyway, about 5 years ago, we still had those problems where medications had medications inside that pill that would not be needed. It's not like in America or other countries that where you wouldn't have that problem. So does that make sense to everybody? Does anybody have a question about that? Okay. I'm sorry, go ahead. I just wanted to make that clear.
Yeah, thank you, Mataji. Further, in smaller villages, it may be difficult to find a qualified medical physician. Some who are pharmacists refer to themselves as doctors. At available medical facilities, cleanliness and safe practices are often substandard. I personally found the conditions in one village hospital to be shocking. When I expressed concern to a physician at this hospital, he said, "This is India. It is dirty out there and it is dirty in here." In the holy Dham of Vrindavan, however, modern medical facilities are beginning to open. Care for the terminally ill is also improving, most notably with the establishment of the Bhaktivedanta Hospice, inspired and guided by His Holiness Giriraj Swami and staffed by Vaishnava physicians and nurses. Even with the added austerities of traveling to and staying in India, the spiritual benefits of leaving one's body in the Holy Land where Lord Krishna once walked are beyond compare. With proper arrangements, it can be the most auspicious situation for a Vaishnava whose death is imminent.
Thank you so much for Jisbari, Mataji.
Thank you, Mataji.
Would anyone else like to continue? You can raise your hand or you can just speak. We have Greg Long. Thank you, Greg.
Oh, it's
Hare
great.
Krishna, everybody.
Haribol, Greg Prabhu.
Haribol Mataji. Choosing a hospice in the West, if it is decided that a devotee will remain in the West, then finding a local hospice to assist you is sensible. A good hospice agency can arrange for special medical equipment, including a hospital bed, begin the devotee on medication regime for pain and other symptom management, provide nursing visits and continual assessments, arrange for a nursing assistant to provide personal care if desired, and provide a social worker and bereavement counsellor to assist the patient as well as the family. Every hospice agency employs a physician as its medical director who is on call for medication orders, emergencies, etc. A patient has the right to continue seeing his or her primary physician or specialist, or to become a full-time patient of the hospice physician. Finding a local hospice agency that will come to your home or temple is not difficult. The following list should help you begin. 1. Ask a physician who has given a prognosis of 6 months or less and has recommended hospice care. Most likely he or she works with 1 or 2 hospice agencies and can refer you to one. 2. If the devotee has been in the hospital, ask the hospital discharge planner to recommend a local hospice agency. 3. If the devotee has private medical insurance, can the customer service number and ask if they can assist you in locating a nearby agency. 4. Check your local yellow pages under hospice. Many hospitals have their own home hospice agency. 5. Call or visit the website of American Cancer Society for information and referrals. 6. Call your state's Department of Social Services and ask for assistance. And I think add into that one, look on the internet, search on the internet maybe for that. And below is a list of some hospice organisations that may be helpful. Each one offers a variety of information. I have noticed organisations that will assist you in finding a local hospice. And I don't think I don't think I need to read them. I can read the titles, maybe.
Sure, that's
Yeah.
fine. Yes, thank
Yeah. Okay. Sorry. VaishnavasCare.org. Mind you, is it useful to read what the organisations do? Would you say?
It's up to you. Vaishnava's
Yeah.
Care.
Yeah.
We can refer anyone anywhere to a hospice organization if they have them in their country. Not every country, unfortunately, has them, but most have something. Yeah, and Vaishnav is spreading hospice in various countries, like in Dominican Republic, Costa Rica, different countries in Latin America are now making it known. We have devotee doctors in charge of some of those teams in Latin America, and they're spreading the concept of hospice in those places.
Okay, I'll read it. Vaishnava's Care, Counselling, Assistance, Resource and Education is a worldwide network of volunteers who offer their support to the terminally ill and their loved ones. Through education, website support and volunteer assistance, Vaishnava's Care, aka VCARE, offers comfort to those in need by integrating the knowledge of caring for the terminally ill with spiritual wisdom given by His Divine Grace A.C. Bhaktivedanta Swami Prabhupada. An online course is included at no charge on this website that can give one a basic understanding of caring for the terminally ill. Final Journey Seminars. This organization offers a free seminar for the Hindu community about end-of-life medical choices, religious services, cremation, legal issues, and financial planning. Hospice Link. This is a telephone service offered by the Hospice Education Institute in Maine. They provide referrals to local hospice agencies throughout the United States. They are an excellent source of information on hospice and palliative care, not only for non-medical persons, but for healthcare professionals as well. Help the Hospices. This is a leading charity supporting hospice care through the UK. If you are a patient caregiver or have an interest in hospice and palliative care, explore this site for information, support, or to get involved. Hospice Foundation of America. Among other subjects, this website has a wealth of information on grieving for a loved one who has passed away. International Association for Hospice and Palliative Care. This non-profit organization is dedicated to promoting hospice and palliative care worldwide. CancerNet. This website provides recent information from National Cancer Institute. Some topics include types of cancer, treatment options, support and resources, and clinical trial results.
Most people don't realize that there are over 200 types of cancer. And so that's a very good resource. If you or a loved one has cancer, it's a very good site. Go on, I'm sorry.
That's okay. No. Children's Hospice International, CHI. This site gives valuable information on pediatric hospice services. CHI provides education, training and technical assistance to those who care for children with life-threatening conditions and their families. The National Family Caregivers Association. This site provides education and information to caregivers, including state and federal agencies in the US, intended to improve the quality of life of those who are caring for an ill, elderly, or disabled person. The association has many resources listed, as well as a page for you to connect with other caregivers. American Pain Foundation. This is an independent non-profit organization whose mission is to improve the quality of life of people with pain by raising public awareness, providing practical information, and advocating to remove barriers and raise awareness of effective pain management. Dying Well. This site is a helpful resource for people facing a life-limiting illness, their families, and professional caregivers. Children's Hospice and Palliative Care Coalition. This is a social movement led by children's hospitals, hospices, home health agencies, and individuals to improve care for children with life-threatening conditions and their families. And finally, Growth House Inc. This website provides links to resources for life-threatening illnesses and end-of-life care. Their mission is to improve the quality of compassionate care for people who are dying through education and global professional collaboration. This site gives you access to comprehensive collection of reviewed resources for end-of-life care.
Thank you so much, Chris. Or would you like to continue?
Yeah, I'm happy
Oh,
to do.
okay. Thank you.
Yeah, if you're okay with that. Okay, well, yeah, I'm happy to do so. Once,
I love your accent, so keep going, please.
okay, that's okay. Once you have contacted a hospice agency, you may want to first inquire about available services and financial arrangements. They should be able to tell you if they provide resources that can find financial assistance for the patient if needed. Very often, the hospice social worker can enlist whatever community assistance is available. All hospice agencies have their own funding for a limited amount of patients who are unable to pay and do not have medical insurance. Some also offer payment plan options. Hospice services are covered under Medicare Part A, and currently 46 states in the US finance hospice care for those who qualify under their Medicaid program.
For those who don't know, Medicaid is part of the government in the United States for people who are below a certain income. So I believe now all states cover that under Medicaid program, which is for low income folks.
Wonderful.
In
In addition, hospice care is a covered benefit under most private insurance plans, HMOs, and other managed care organizations. If the patient does not have medical insurance or a prescription payment plan, then the hospice staff should be able to tell you which pharmacies in your city have more affordable rates for prescription medications. Also, medications ordered by generic names are less expensive than those ordered by the trade name. For example, acetaminophen is a generic name for Tylenol.
Go ahead, I'm sorry. Go ahead.
Which is a trade name.
Yeah, so in other words, I think in Europe it's called paracetamol, right? And that would be the generic name, and Tylenol in America would be the trade name. So if you order paracetamol, it would be less money than the actual trade name, which would be Tylenol or like that.
Well, this is really interesting, Mataji, because coming from the UK, everything's free. from a medical care point of view. And then a lot of the hospices are funded partly by government and other charitable organizations that run fundraising for the hospices that pay the staff. So it's really interesting to hear America and, you know, and other parts of the world where it's potentially more difficult for patients.
Yeah. Yep. People think America has the most amazing medical care, but not true. Very difficult.
Hospice agencies may advertise themselves as Medicare certified or JCHO certified. Simply stated, Medicare certifications mean they have met federal minimum requirements for care and management. JCAHO stands for Joint Commission on Accreditation of Healthcare Organizations, which is a nationally recognized accrediting institute. If a hospice agency has sought and received accreditation, it is committed to providing the highest standard of patient and family care. It is a good idea to question the hospice agencies about certification and accreditation. Following are other questions you may want to ask. And does anybody else want
Thank
to
you.
take the opportunity to read?
Does anyone else would like to read?
I can read if you like.
Yeah. Okay.
Does the agency have a nurse on call 24 hours a day? Will he or she make a visit to the home in the middle of the night in an emergency situation? How often will the primary nurse visit the home per week? What will he or she do during these visits? Who will visit on his or her day off? Will the alternate nurse be familiar with the patient's medical condition? What does a nursing assistant do? If desired, how often will he or she visit? What does the care team consist of? Social worker, counselor? Who is the medical director of the agency? Will he or she work closely with the patient's own physician? What assistance is available for family members, such as bereavement counseling? Does the agency provide medications? Does it provide necessary medical equipment? Does the agency provide inpatient care in a hospice unit, hospital, or long-term care facility? Would this option be available for crisis situations? Would it be available to the patient as a way to provide respite for the caregivers? It is important that the patient and caregivers feel comfortable with the hospice nurse who will first come to the home or temple to make an initial assessment. He or she will evaluate the patient to see if he meets the hospice criteria. The patient, caregivers, and family members need to feel satisfied with the nurse's answers to their questions. This might also be a good time to mention the devotee's vegetarian diet, so the nurse is aware of what can and cannot be recommended for nutrition. A good nurse will be non-judgmental and may even welcome a new opportunity to care for a devotee of Lord Krishna. Many hospice nurses enjoy learning about cultural and religious differences from their patients and families. Continue or someone else?
I can read. Can I read?
Yes, please.
Okay. During the initial visit, the hospice nurse will ask if the patient has a living will. Now, this is different than a last will and testament where you list, your home, your car, your jewelry, your money, and who it's going to go to. A living will is different. If not, he or she can usually provide you with a living will to sign. The purpose of a living will is to have a written record of the patient's wishes concerning treatment that will unnecessarily prolong life. It is a legal document that is signed, dated, and witnessed, and serves as an advance directive should the patient be unable to express her desires at the time such treatment might be administered. Some living wills state one's wishes only in the case of a terminal illness. Most likely, this will be the type available from the hospice agency. Other living wills state what a person would want done or not done if he were in a state of permanent unconsciousness, as in the case of a serious accident, for instance. Some give up to 6 case scenarios with treatment options to be accepted or refused in various circumstances. This is the case. This would be so. If you go online, it's what's it called? Anyway, let's go on. I might mention it later on. A living will protects a patient's right to die with dignity. It ensures that treatment will be limited to comfort measures and pain management, including any discomfort that might occur as a result of withholding life-sustaining treatment. It usually includes a checklist of interventions, such as the following. And then you would just circle do or do not want. So I do or do not want cardiac resuscitation, including CPR and or chemical resuscitation. I do or do not want mechanical respiration to be placed on a ventilator. In other words, do you want a tube put down your throat and have a machine breathing for you when you can no longer breathe on your own? Okay. I do or do not want tube feeding or any other artificial or invasive form of nutrition, food, or hydration, water. So do you want them to, put in a nasogastric tube down your nose into your throat, right? And then going down into your esophagus. And then it goes into your stomach and then down to your GI system, into your intestines. And that could be that they would pour that stuff like Ensure or that kind of liquid supplement into the tube, and then it would go eventually into your GI system. So do you want that when you can no longer swallow on your own and chew your food and eat on your own? Or do you can also have them pour water in there. Okay, is that what you want? Or do you want them to just let you stop eating and drinking on your own, and then within probably 10 days, you would just pass away naturally? So you can circle, you do want it or you don't want it. Okay, the next one is I do or do not want blood or blood products. Would you want a blood transfusion? Okay, I do or do not want kidney dialysis. For example, I'll use myself as an example. I'm diabetic and I have stage 3 chronic kidney disease from the diabetes. So I circled, I do not want kidney dialysis. When it's my time and my kidneys fail due to the diabetes, I don't want to be on dialysis, and I do not want a kidney transplant. That's my opinion. There might be others out there listening and they may want that. Everybody has an individual right to circle I do or do not want. Okay. And you can still have this living will, but circle do or do not want. You don't have to circle I don't want on everything. It's your business to circle whatever you want. Okay. And the last one is I do or do not want antibiotics. And if desired, you have the right to state that you will accept antibiotics for comfort measures only, but not to needlessly extend your life, as in the case of taking antibiotics to cure pneumonia. Okay, so I'll use myself as an example again. On my living will, I put down that I don't want IV medication, intravenous medication, to save my life. But if it's for comfort measures, as in the case of pneumonia, just let me go. I don't want to get cured. I just want to be comforted. Just give me something that will make me comfortable and let me go when it's my time. So you can put whatever you want. Okay, but this is an example of a living will. Every living will is written differently. However, most will include a space for the patient to designate a medical power of attorney, okay, a POA. This should be a well-trusted associate or family member who can make medical treatment decisions for the patient if he should become incompetent or is in a state of unconsciousness. Okay, the power of attorney will speak on the patient's behalf to refuse or accept life-sustaining treatments if the patient is incapable of making these decisions. It is suggested that an alternate power of attorney be listed on the living will in case the first choice is unable or unwilling to make a decision. In other words, if, let's say, you chose your sister or brother or spouse, and by the time it comes around for them to be called upon to live out your wishes on your medical living will, but that person is now passed away, or that person has dementia or Alzheimer's and isn't able to make that decision. I mean, not make a decision, because you've already made that decision in your living will. You already chose these things. All they have to do is follow your directions. Okay. So you've already done the hard work. You already put it on paper what it is you want and don't want. They just have to be able to follow it. So you're taking the burden off of that person, really. Okay, but let's say they no longer are here, or they no longer can follow that direction because of some, dementia, or they're just, I've seen where a family member can't follow that direction of yours because they can't, it's too difficult for them. They can't say to the doctor, they don't want to be kept alive on a ventilator. They don't want a tube down their throat. They can't bring themselves to say that because they're very, very attached to you, and they can't say it. So you have an alternate power of attorney, medical power of attorney, and they go to that person, and that person says, yes, we want to do what our loved one wants. So please don't put him on a ventilator because he does not want that. So one of the medical power of attorneys has to say what you want. Understand? No, anybody have a question about that? Anybody's hand up? No? Traveling? Okay. So every state or country, some countries don't even have this law. They don't even have an opportunity for a patient to have a medical power of attorney, believe it or not. When I was building the hospice with C.A.R.E in Vrindavan, I researched, and India at the time, which was only like 5 years ago, they didn't even have a medical power of attorney law. So it was extremely difficult, but we had this in place at the hospice in Vrindavan, even though the government didn't recognize it, but we put it in place. So every state differs in its requirements, but it is necessary for the power of attorney and the alternate to be of legal age. The hospice agency will keep a copy of the living will on file. Usually the original legal document is kept with the patient or your primary caregiver. Most living wills also provide room for additional comments. Specific requests by the devotee should be written here. For example, quote, I request my family, friends, and caregivers to provide continuous chanting of the Hare Krishna mantra if I become unconscious or am too weak to chant myself, unquote. Below is a copy of a living will written by Kusha Devi Dasi, a senior disciple of Srila Prabhupada. It is a fine example of a living will written specifically for Vaishnavas. In the United States, living wills are now recognized in all 50 states, but each state has individual requirements. Can we go up? Rasika Prabhu? Thank you. A little higher.
Yes,
Therefore, recommended to seek consultation with an attorney in the final preparations of such a legal document. Can we go up?
We're actually short on time. It's already time. It's 12:47.
Okay.
Yeah,
Go.
it's ready to.
So everybody look over this living will before next Sunday when we read again? Can
Yeah,
you
actually, speaking of next Sunday, we'll have a Q&A session next Sunday. So this is where you get the opportunity to ask questions, any questions about what we've read so far, or anything related to the book or Vaishnava C.A.R.E, anything that comes in mind. So this is going to be a great opportunity for everyone to have a more interactive session next week. And yeah, sorry to cut you off, but actually we also have sample of living will, so we can send it over to devotees in our chat and WhatsApp chat. So you can all print it out for you and have it on hand if you like.
Right. That's great. Thank you.
Yes. So thank you so much again for joining our reading session, and we're looking forward to the next Sunday. And we'll open the chat again for about 2 hours where you can ask some questions and we'll able to respond either through audio or typing. Sorry.
If they want a copy of the living will, how do they get it?
So I can just send it in the chat like as a document, and devotees can download it and use it as they will. Yeah.
Okay. Everybody get that?
Yeah.
Thank you.
And yeah, everyone should have living wills, honestly, regardless of age, because anything can happen.
If you're 21 years old, okay, everybody, because we had a couple in South America. They were 20, both of them, husband and wife, and they had a car accident. She went right through the windshield and was what they call brain dead, okay, for lack of better term. And they put the phone to her ear, and her guru got on the phone and chanted to her as they pulled out the ventilator. And as she was leaving her body, she heard her guru chanting to her. But it was a big thing to get the doctors to take the vent out. So you don't want to go through all that. You want the living will, no matter how young you are. Please have one.
Yes. So that's
Okay.
so we can share it. If you like, you can print it and fill it out, adjust it also as you like. So we just wanted to thank everyone again for joining the session, and also especially those who are not in the healthcare, because I made a big deal, about all those in the healthcare, but also would like to acknowledge those who are not in the healthcare, and thank you for joining. This is important for everyone. And what else? We're gonna send a little survey, like a form you can fill out in the chat shortly after today's session, for those who are in the healthcare and would like to connect with us more offline about how you can serve more in this capacity for devotees. So that will be coming also, and I will send the living will as well. And just a reminder, please follow us on social media, on Instagram and Facebook. We'll send the links as well. And we will also looking into having a deep dive workshop in mid-November, probably on November 17th. We're going to announce the topic soon, and it's going to be about 2-hour workshop with Sangeeta Mataji, and we're looking forward to that as well. So we'll see you next week. Sorry, we're a little bit over time, and thank you again, everyone.
Maybe Taravali, we can take the last picture together and we can
Yes.
share on our group if
Yes,
anybody
yes.
can available on the camera.
Let's do, if you're comfortable, yes. Thank you.
Thank you.
Put on your cameras.
Little hat.
Who is going to take the picture? Me?
Yes, you.
Okay.
Yes.
Okay. 3, 2, 1. All right, just one more. I think we are many here. Not that. One more. 3, 2, 1. Okay, that's it. Thank you so much, everyone.
Thank you.
Thank you.
Hare Krishna, everyone.
Hare Krishna.
Have a good week.
Bye.
Yeah, thanks a lot.
Bye.
Thank you.
Krishna.
Hare Krishna.
Mhm.